Clinical Pearls in Headache Management, From Theory to Practice. Welcome everyone, and thank you for joining today's session on practical approaches to headache management. In the next hour, we'll explore essential clinical pearls that can transform your approach to treating one of medicine's most common yet challenging presentations. This lecture will be presented by chiropractic neurologist, Dr. George Cook-Rinn. Every day, somewhere between 15 to 20% of the world's population experiences a headache. As clinicians, we often find ourselves at the front line of headache management, tasked with differentiating between the benign and the dangerous, the simple and the complex. Yet despite headache being such a common complaint, its optimal management often eludes both novice and experienced practitioners alike. This lecture isn't about reciting textbook classifications or reviewing basic pathophysiology. Instead, we'll focus on practical, evidence-based approaches that you can implement in your practice tomorrow. We'll explore the art of the focused headache history, learning to pick up subtle clues that can dramatically change your management approach. You'll discover how asking "what do you do when you get a headache?" can often be more revealing than "where does it hurt?" We'll delve into the often overlooked psychosocial dimensions of chronic headache management, examining how addressing a patient's headache-related anxiety can be as important as prescribing the right medication. You'll learn clever clinical shortcuts that can help you rapidly distinguish between primary and secondary headaches, and we'll discuss red flags that should immediately grab your attention in any headache presentation. Most importantly, we'll cover practical treatment strategies that go beyond the standard medication algorithms. You'll learn about simple lifestyle modifications that can yield surprising results, and we'll explore how to personalize treatment plans based on individual patient characteristics and preferences. By the end of this hour, you'll have gained a toolkit of practical approaches that will help you navigate the complexities of headache management with greater confidence and effectiveness. You'll learn when to worry, when to reassure, and most importantly, how to help your patients achieve better control over their headache symptoms. So, let's begin by exploring what I consider the most crucial skill in headache management, the art of asking the right questions.
All right, let's switch gears and dive into the fascinating world of neuromodulation of the vagus nerve. We can access this nerve through the ear, specifically at the external canal on the inner side of the tragus, or at the cymboshantia on the outer part of the ear. It's pretty straightforward. If you take a look at the slide on the right, you'll spot the ear clip electrode. Here's where it gets really interesting. There's a nerve called Arnold's nerve, which is a cutaneous extension of the vagus nerve. By stimulating Arnold's nerve in the ear, it can actually antidromically stimulate the vagal nerve, leading to effective vagal nerve neuromodulation. Now let's explore some studies that demonstrate how this technique can be quite effective in treating various forms of headaches in our patients. This handbook chapter provides a comprehensive overview of neuromodulation approaches in migraine treatment, emphasizing both invasive and non-invasive techniques. Thus, the authors highlight how these treatments offer alternatives for specific patient populations, particularly those struggling with conventional treatments. This state-of-the-art review provides a systematic evaluation of cluster headache treatments, notably placing non-invasive vagal nerve stimulation among the highest evidence-grade interventions for acute treatment. This systematic review, though limited by the small number of available studies, provides solid evidence supporting vagal nerve stimulation's effectiveness in cluster headache management. This comprehensive review indicates promising results for auricular transcutaneous stimulation in migraine treatment, supported by both clinical outcomes and neuroimaging evidence. This study provides important mechanistic insights into how TEVNS affects brain connectivity patterns, correlating these changes with clinical improvements in migraine symptoms. This research reveals specific brain network changes associated with TEVNS treatment in migraine patients, providing insights into potential therapeutic mechanisms. This comprehensive safety analysis establishes TVNS is a well-tolerated intervention with primarily mild, transient side effects and no serious safety concerns. This makes the procedure ideal for headache treatment. The slide showcases the connection between two key electrodes, one nestled in the inner ear, beneath the tragus, and the other located on the cymba concha on the outer pinna of the ear. All right, let's dive into the essentials for setting up a neuromodulation lab in your clinic. Check out the slide here. What you're looking at is a headband designed to securely hold the electrodes in place, which we'll demonstrate shortly. You'll need a few key items: ultrasound gel, carbon implanted electrodes, the black and red ones, the TENS unit, and some self-stick electrodes. If you're planning on tongue stimulation, there's a special electrode from Amorex that's not marketed specifically as a tongue stimulator, but trust me, it works like a charm with the TENS unit. We've been using it for years. Now let's see how all these components come together for some non-invasive neuromodulation targeting cranial nerves, especially in the context of headache treatment. All right, let's dive into the suboccipital nerve. If all your patients were completely bald, this would be a breeze. But since we have to navigate around hair, using a self-stick electrode can be tricky. Instead, we'll opt for rubber or carbon-impregnated rubber electrodes. Positioning is key here. You'll want to stimulate the suboccipital nerve to modulate the trigeminal ganglion in the brainstem. In my experience, this technique works wonders for cholesterol headaches. Don't forget, you'll need a headband to keep those electrodes securely in place since they aren't self-stick. Plus, grab some electrode gel or ultrasound gel as a conducting agent to help you get through the hair. This neuromodulation technique using the suboccipital nerve is incredibly effective for tackling trigeminal headaches. As we move to the front of the body, let's set up for the infraorbital nerve, which we previously discussed in relation to laser treatment. This area is not only crucial for that purpose, but also incredibly effective for treating various types of headaches. Here we have the supraorbital nerve. We talked about how it exits just above the eyebrow at the base of the forehead. This nerve is a fantastic option for both preventative measures and treatment techniques involving neuromodulation of the trigeminal ganglion. You can use self-adhesive electrodes for this setup, just like with the intraorbital nerve, since most patients don't have much hair on their faces. So this is the setup for treating the sun or supraorbital nerve. Here we have a fascinating blend of supraorbital nerve stimulation and suboccipital nerve stimulation happening simultaneously. Take a look at the setup we've discussed. It's all laid out right here. The key is to keep the stimulation mild, just enough for them to barely feel it. We definitely don't want to over-stimulate the nerve, so we'll gradually increase the intensity. Once they can feel it, that's our sweet spot. And there you have it, the combined setting and action.